Hello and welcome to Varn Blog and our monthly correlated segment with Strange Maggers magazine. Today I am talking to Zhala Taghi-Zada, whose recent article, "The Complex Stigma of Schizophrenia," subheading "Brian's Law in Canada demonizes and terrorizes people with schizophrenia. We must find a better way," is useful for discussing the broader issue of mental health stigmatization and its policing, which it's also important to put in perspective that our Canadian neighbors, while they may be more civilized on healthcare issues and not rely as explicitly on the police the way we do in the United States, still do in a lot of ways, as does, as we were talking off air, Australia, the UK, etc. In the United States, we largely just kind of don't have services for a lot of these things. And so it's either handled by private care or by the criminal justice area explicitly. And in fact, in the US right now, if you're going to have a lethal encounter with a police officer, the biggest factor is whether or not you have mental illness. For my non-Canadian listeners, what is Brian's Law?
Okay, so Brian's Law is basically this legislation that originates in 2000, but the story actually kind of goes earlier than that because specifically in 1995, there was actually a very violent case that kind of shook all of Canada. There was a sportscaster named Brian Smith. I think he actually was a hockey league player before that, so he was very beloved. He was a public figure. He was actually walking outside one night after, I guess, his work day, and he was shot and killed by a man who has paranoid schizophrenia. His name was Jeffrey Ehrenberg. He had been off his medications, and he had some kind of, episode that made him act out violently. And unfortunately, he did kill Brian Smith. And so this caused a major public outcry. And it was in some ways like egged on and fueled by the media, which sensationalized the story a lot. And like, it really mythologized Brian Smith as this character of great, honesty and like a lovely person and like a great beloved guy. And it really demonized Jeffrey Ehrenberg as this sort of like crazy killer who was sort of deviant and, is very dangerous and, lock your doors kind of vibe. And it culminated in eventually Ontario passing this legislation, which actually it's called Brian's Law, and it's essentially it creates this thing called community treatment orders, which are basically a set of conditions that a physician will put forward for a person who has schizophrenia, who has been previously institutionalized. And there's just things that they have to follow. It can include things like medications. It can include things like lifestyle choices like smoking or having alcohol. And if the person who has schizophrenia, if they don't follow this order, these conditions, they could actually be forcibly taken by the police or by the physician's order and reinstitutionalized, essentially. So basically, it's like a set of conditions that you must follow if you want to live in the community again, essentially. And it's been met with a lot of controversy because, I guess we're going to get into it, but it basically takes away a lot of the decision making and autonomy of the person who has schizophrenia. And it also kind of like paints the entire group of people with the same brushstroke. It kind of assumes that everyone may be dangerous to themselves or to others. And upon a single thing being like a single lifestyle or such condition being broken or not followed, they could be put back into a facility, which is incredibly unethical. And my article, basically, I talked a little bit about the ethics behind it. I talked about how it's extremely paternalistic because it basically assumes that like for the best interests of the patient, we must force them to follow these conditions. And if they cannot, then not capable of being in the community, essentially, and we have to put them back into the facility. And there are a few ways in which the person could be, admitted into the facility involuntarily. One is if the police, I guess, arrest or detain them. And Another way is if a person, any person, reports them to a justice of peace as like under a concern of them being dangerous to themselves or to others or acting erratically. And then the third way is if a sorry, I can't speak. If a physician examines them and decides that, well, this person, based on my judgment, is potentially a danger to themselves, to others. They may be disorganized excessively, maybe if they're off their medications. These are all grounds that the physician can use to essentially revoke the CTO and then decide to put them into a facility. Yeah, hopefully that was a good summary.
Yeah,
um,
that's a great summary. And I think one of the interesting things here, we were talking about this, I do have to contrast this with the US perspective, where we don't have this problem because we don't even have the capacity to have this problem.
right.
We shut down most of our mental health institutions and essentially privatized mental health care almost entirely in the 1980s. So, and yet one of the things that I thought was applicable to all the situations, including here in the US, is your discussion of how these laws, even the ones that seem not as pernicious as, say, the situation here, Brian's law seems pretty targeted against a specific mental health group, and we will talk about the specifics around schizophrenia in particular, because I realized as I was reading your article that, yeah, you know what? I've not heard a lot of discussion about normalizing and reintegrating schizophrenics. We don't talk about it.
Yeah.
And I think about this because I've known schizophrenics, and uh, I have family members who have schizotype seizures, so I'm familiar with the condition. And yet, even I was like, you know what? I don't think about this very much, honestly. I guess it's so stigmatized; it's out of my mind. Um, so, let's talk about the stigmas around schizophrenia kind of generally. And you bring up in your article a UK report, which I think is very illustrative, but um, uh, is speaking to the wider context than just Canada. So, what are the stigmas around schizophrenia, and why is this one so much harder to deal with than, say, stigmas around bipolar disorder or spectrum disorders, etc.?
Yeah, so I think that there's different kinds of stigmas, right? So there's the self stigma, the internalized stigma, there's interpersonal stigma, and there's also institutional stigma. And I think that it's important to talk about all three. So institutional stigma has to do with how specific professionals may have certain kind of prejudices or may promote or I guess feed certain stereotypes of certain people. And this can translate into decisions, I guess, in particularly in healthcare, it can translate to decisions that will not respect the person's bodily autonomy or alienate them further or cause isolation or harm them in some way. So very, very common in healthcare, unfortunately, because a lot of physicians are simply not trained to treat or even interact with a person that has schizophrenia. There actually was a peer-reviewed report recently where it was found that physicians will actually have much lower stigma towards depressed people with depression compared to schizophrenia. I mean, they'll still have some degree of stigma towards people who have depression, but like it's much higher for schizophrenia because they don't receive a lot of training that has to do with how you can speak to or interact with or provide information for a person who has schizophrenia. And another thing that I have found when I have been reading through all the literature is that a lot of clinicians tend to have have this assumption that schizophrenic people will never recover, basically. There's this idea that they can never be helped. It can be managed. It can be like, we can reduce the damage by possibly putting them into a facility, but they'll never actually recover. So there's these stereotypes that are, I'm assuming, left over from many, many decades of stigmas that have built towards mental illnesses in general. But I think the reason why it's so much worse for schizophrenia is just because of how it manifests itself, I think, because a lot of the symptoms, which may include delusions or paranoid behaviors, are a lot more difficult to understand sometimes because they kind of tend to go against social norms. If you look at, depression or anxiety, you might think, well, I have anxiety sometimes, or I get sad sometimes. You're not necessarily getting it very accurately, but you can somewhat conceptually understand what it's like to have depression and anxiety, and so you're much more likely to have empathy towards those conditions, right? It's much harder to I guess, comfortably speak about a disorder where the symptoms often go against social norms. And this is much harder, even so, because we often just don't really talk about it at all. Like, it's very kind of like, mum, it's very quiet. It's very like, it's often left out of discussions. If you have mental health days at like your university or your school, often they don't really talk about schizophrenia. They mostly talk about just the safe ones like depression and anxiety. That could also include bipolar. I think bipolar is like considered to be less stigmatic than schizophrenia, even though it's extremely stigmatized too, right? So I think it's just sort of that kind of like difficulty, that barrier in understanding the fact that people who have schizophrenia are often isolated. And I mentioned this a little bit earlier, but the media tends to sensationalize those couple of examples of violent interactions that do happen here and there. Not that I'm trying to minimize them, obviously, but if you look at the odds of actually being killed by a crazed, killer, as they say in the movies, it's actually extremely low. It's like 1 in 14 million, I believe, which is extremely low. It's lower than being struck by lightning twice. It's very low. So there's this idea that, you can be really killed by these people. They can be violent towards you. In reality, you have very, very low chances of that ever happening. And actually, in reality, people who have schizophrenia tend to be more likely to be victims of violence than perpetrators. So lots of deep-rooted beliefs that kind of fuel the stigma, unfortunately.
Yeah, there's both the media narratives around this in the terms of news media, and there's also the media narratives around this in the terms of fictional media. And
Yeah.
schizophrenia has been kind of used as the blanket diagnosis in fictional media for lack of a better term, fucking bonkers for a long time, including portrayals that have no relationship to the clinical diagnoses at all.
Yeah.
The conflations with multiple personality disorder, a disorder that may not even exist. There's a lot of this with schizophrenics, and I have thought about that, but I've not put it in the context of passing laws, and even in places with more social democratic safety nets, it's still being so heavily stigmatized and criminalized. I mean, you start your article off with a specific instance that I was reading. I was like, well, this feels like America. So you want to talk about that specific instance?
Yeah, sure. So I talk about a news article I found basically that like shocked me because it was outrageous to me. It was basically, there was this student at the University of Toronto. It's where I went to school, and she had been studying and had been very overwhelmed, and so she went to the help center to ask for some kind of support because she was having a lot of anxiety and having suicidal ideations. And the clinician there told her to go to a hospital immediately. She had an exam that day. We all know, if anyone has gone to U of T, they'll know how insane exams there are. You don't want to ever miss one. So she basically said, like, I'll go tomorrow because I can't make it today because I have an exam. And the clinician called the police, the campus police, who essentially just like detained her, pulled her out of the building, put her in the police car, and then took her to the hospital against her wishes. and would not even allow her friend to come along because, I mean, I'm not sure why they didn't allow it to happen, but she was having an anxiety attack and a panic attack during this whole ordeal. And the shocking thing is that this is not a very unique situation. This has happened many times, and there have been many outcries from the student union, from the a lot of student protests. UFT has a very bad history with this. I mean, in the year that I was graduating, there was a person who committed suicide from the engineering building, and UFT was incredibly silent about it. And I think after I graduated, there were 2 more suicides that happened in the same building, and their response was to put temporary barriers around it. And it's like, okay, this is not helping at all. This is actually very insulting to the people whose families are grieving right now. And I guess this is not exactly about schizophrenia. This is more about suicidal ideation, but I think it's still treated as the same kind of like, I guess state violence is the right way of saying it, because there's this sort of like forceful removal of a person's bodily autonomy. And there's this idea that, well, once someone becomes suicidal or once it becomes too much for us, we just remove their decision-making skills, decision-making like apps completely, right? And so that was a very shocking incident. And I mean, UFT has a pretty bad history when it comes to mental health. In 2018, they actually tried to kind of like quiet down the protests from students by offering a policy that would force a mandatory leave for students who have mental health illness, which is like obviously extremely problematic because most students want to just continue their studies and just have support while they study, not be like kicked out of school, essentially, right? So they've had a very poor history of understanding how to reckon with serious mental health crises. And yeah, that's essentially kind of a good summary of how I came across that article, how it ties into the idea of this paternalist attitude towards mental health. And yeah.
Yeah, the paternalist attitude seems endemic, like I said. And what I find interesting about that instance is it shows how quickly that paternalist attitude can transform into a criminalized attitude, and particularly with something like schizophrenia, which is unfairly and unjustly aligned with violence and instability. As you say, it's in most countries the likelihood that the schizophrenic is the one doing the abusing is actually quite low,
Right.
And I have looked at the numbers for the US and it's abysmal. The long-term outcomes for schizophrenics, it's quite bad. One of the things that you bring up though is like the assumption, for example, that schizophrenia will lead to suicide as opposed to other difficult to deal with mental health conditions. For example, post-traumatic stress disorder, which is, I think, heavily stigmatized, but in a way quite different from schizophrenia, and one that actually has more clear ties to violence, to be honest. There seems to be no assumption there that you're going to get better, even though with post-traumatic stress disorder, there's a lot of talk, a lot of the popular discourse is about people improving. In reality, the numbers are actually quite similar to schizophrenia. What I find fascinating about this, to me, is one, the kind of false binary between mental health conditions from which you can fully recover and then mental health conditions treated as they're completely irrecoverable, but then also instituting things that are more comorbid with, say, suicidal ideation or suicidal attempts than while also blaming that on the schizophrenia. So the big example of that is one of the things that's commonly done to schizophrenics is they are socially isolated, which even if you are of relatively normal mental health profile, whatever that means, is strongly associated with suicidal ideation for everybody.
Yeah.
Like, So it also seems like even in places where we have a slightly more medicalized view of things like schizophrenia, um, it as opposed to criminal one, it still seems like we do things that exacerbate the conditions of which they are stigmatized.
Yeah, absolutely. I think so. I think that there's also evidence that the stress, the traumatic response that you feel from isolation can also exacerbate the actual symptoms of schizophrenia. And there's pretty solid evidence that stress can actually make the onset of symptoms become earlier. So, if anything, it's just going to become a vicious cycle of, you know, things that feed this kind of severe symptomatic profile, and the continuous like lack of help and lack of empathy towards these people who um, like we're all social beings, right? Humans are social. We need to create bonds with each other. We all benefit from support. And if we're isolated, then of course it's not going to go well for us because we have no one to relate to. We have no one to speak to about our issues and about our experiences. Um, and Yeah, I think that's a huge problem of schizophrenia. And I think that there have been some studies that have found that um, people who like interact with mentally ill patients, particularly in settings where they have similar goals or similar interests. They're much more likely to have positive outlooks or empathetic empathy towards those people. If you're, working in the same place, or if you're like doing advocacy work together or whatever, right? You're more likely to be able to bond or understand each other. So isolation is the opposite of what we actually need to do.
Yeah, I was thinking about this too, and I don't know if you talk about this, but also the idea of relative equality. Because I can tell you, for example, I'm a teacher, and I work with a lot of uh, we might call special needs, or I like to call more supports populations.
Okay.
Um, and specifically for me, it's spectrum disorder and complex post traumatic stress syndrome in children. Um, and one of the things that I can kind of tell you is, and this is anecdotal, but if I had done the research, I probably could back this up, that teachers who view the students as possible equals tend to have better relationships with them, whereas teachers who deal with those students as deviations from a norm um, tend to paternalize them and then often demonize them, quite frankly.
Yeah.
I mean, I think the word demonize is appropriate because they are treated as if they're a special subcategory that is just going to always be disruptive. Um, Now, I do not deal with schizophrenic students on a regular basis. One of the things that I can say in the United States is often those children are removed from the general classroom um, almost entirely. They're uh, um, and for reasons of quote safety unquote. Now, I have dealt with some students who were unsafe. Generally, that is because of um, of severe intellectual disability and not realizing their size to uh, to action. So they're not trying to hurt you,
Mhm.
but they don't quite interact with the world as adults. But I have noticed that that's also where we tend to put obvious schizophrenic patients, which does two things. It actually, one, incentivizes parents not to get diagnoses for those students because it effectively blocks them out of getting a normal diploma, etc. So if you're a low supports case, you're the incentive is for you not to seek supports at all and to maybe hide the diagnosis from the state. Now, I don't know that in other countries uh, if that's even done. I mean, one of the things about the U.S. is we do have really strong medical privacy laws. Um, so there is that.
Mhm.
But we've had similar instances with both parties in the United States using schizophrenia for example, as an excuse for high gun violence rates. You
Right.
know, the we don't need to control guns, which I have a complicated view on. I'm not going to go in here, but versus the we need, you know, well, we can provide more mental health criterion, and this is something that Democrats have also picked up on. It's not just a Republican talking point. Um, I worry about that for the reasons that you say. There's not a lot of evidence that in most cases that, you know, that most of these mental health patients are actually dangerous. Um, and they are far more likely to be victimized by caregivers and police than anybody else.
Mhm.
Um, so uh, I think that backs up your point. One of the things, though, that I also find interesting about your essay, because you actually do go into some of the things we could start focusing on to destigmatize schizophrenia. So let's talk about these potential focuses for like public awareness here.
Yeah, okay. So, I mean, I think, um, well, I think the awareness like is really important. So I kind of mentioned the idea that if you have the same goals, the same interests, you're much more likely to have empathy and like positive outlook on other people. So I think it's important to have that type of sort of like community, like having a person who is schizophrenic be allowed to freely actually live in the community and be allowed to get a job, be allowed to kind of go to school and continue studies as everyone else would. Now they probably would need certain kind of supports to help them manage their treatment and manage their condition, obviously. But I think that one of the other really important ways of doing of destigmatizing is to change how we like the kind of dialogue we even have around schizophrenia. So it's interesting that you mentioned the thing about crime and using schizophrenia as like a scapegoat to like excuse gun laws and stuff. The provincial government at the time of Bryan's law passing was actually conservative, and they actually came at this with a very conservative, like a law and order perspective than a social well-being perspective. So it's kind of funny how that happens. And in a lot of the articles at the time, back in the 90s, that when the murder of Bryan Smith happened, they kept kind of citing the fact that, oh, the criminal, like the amount of violent crime this year has been going downwards, and yet we had this horrific shooting. And they kept putting that fact into the articles as if this one shooting by a man who was off his meds would undo that whole like decades long trend of decreasing violent crime, right? So there is this continuous like depiction in media of extremely violent, dangerous people. And so we have to somehow restructure, I think, how the media will portray schizophrenia. I think in some ways, a lot of fiction is doing better nowadays than it used to, at least. Maybe like very progressively better, not much better, but still, it's progress. And I think another way of doing this is to have a lot more sort of advocacy groups for people who have schizophrenia. An interesting trend that we've been seeing in Canada is that a lot of mental health groups actually have like changed their names and have removed schizophrenia from their names because it's not considered to be mainstream, or like it's considered to be unappealing. And we really have to get past that issue, because it shouldn't necessarily matter how appealing or mainstream the name of a mental health group is, right? It should be just like we're here to support people who have schizophrenia. So I think a push in that direction of just like opening up a more approachable and sort of supportive environment. And I think it's kind of like I feel like schizophrenia is kind of like the backyard of like all these social problems, because it kind of brings out everything that's a lot of things that are like kind of flawed in our society. For example, people who are homeless are much more likely to have schizophrenia, because people who have schizophrenia and when they experience stigma are less likely to have stable jobs, are less likely to be able to support themselves, much more likely to lose their homes and unfortunately be on the streets or be in shelters. And that's why we often see a very high prevalence of schizophrenia among homeless people. People in the general public tend to view the homeless in a more negative way. And so when they interact with a person who's homeless, it tends to scare them a little bit because we either look at people who are homeless as invisible or as dangerous, right? That's kind of how we look at them. And so I feel like another issue we'd have to grapple with is how we treat people who are homeless, right? Why aren't we giving them houses? Don't they deserve that, right? So it kind of brings out all these issues that we have to deal with, which is the fact that there's a lot of people who are homeless that are schizophrenic. Other issues that come up include the fact that we actually see a racial disparity in schizophrenic diagnoses. There was a report recently that people who are African American, I think this is in the US, people who are African American are 7 times more likely to be diagnosed as schizophrenic than people who are white. And there's this apparent idea or apparent like implicit bias and an assumption of more deviant behavior from a person of color than from a person who's white, right? So there's all this like, this just brings out all these problems within our institutions, such as racism, such as homelessness, and all of that kind of needs to be addressed. It's kind of like you have to fix everything. I feel like.
Yeah, I think that, I mean, the homelessness issue and having worked with homeless populations, one thing that I can say, here in Salt Lake, where we actually at one time did have a world standard homelessness program, which we dismantled because it was slightly inconvenient to downtown, and now have the same problems that most cities, whether they're liberal or conservative, have with a high degree of homeless population. If you work with them, yes, I will admit that if you are used to certain standards of decorum, it can be hard to deal with. A lot of it has to do with dealing with substance abuse issues, though, more than mental health issues. And when I worked with specifically a lot of the mentally ill, and they probably were in the schizophrenic bipolar range, from the way they acted, it was intimidating at first, actually, but once you get used to it, it's like you said, you're just like, oh well, okay. They're not dangerous, they're weird, and I know how to deal with weird and quote normal people. I just have to like expand the category a little bit for this. Um and honestly, when it came to like antisocial behavior, they were probably the least likely to offend, which again, I'm just speaking from anecdotes. I will admit that I don't have data on this. But I can say the weird guy muttering to himself around the grocery store is not the guy I actually am afraid of now that I've hung out with some of those populations. I'm afraid of other people.
Yeah.
And to be honest, another thing is in most of our countries, even in the US where gun violence is far more prevalent than in Canada, I always say this, I worry about the way we frame that because it is still relatively safe in most places, including most major cities. Um, where it is unsafe, and there are places in the US that have murder rates roughly equal to, say, Honduras or something.
Mm.
The conditions are actually quite specific, and it can be explained almost totally sociologically. It's not going to be explained by mental health,
Yeah.
and it's actually largely off the radar of both parties' discussions. For example, the most violent cities in the U.S. are formal industrial mid-sized cities that have largely been laid to waste and are now, for both white and people of color populations, largely being used for like organized crime, trafficking, and this and the other. And it's off the map in discussions. And you see homeless people being blamed for that. One of the interesting things right now is, even though we've had an uptick in homelessness post-COVID, You can't tie the murder rate to the homeless problem here, nor can you tie, although some people try to, nor can you tie. There's actually been, interestingly, a decrease in property crime, which is something that is usually somewhat legitimately attached to homeless populations for kind of obvious reasons. Like, it's not to totally excuse it, but if I'm homeless and I'm starving, I'm not gonna have a problem taking something off someone's porch.
Whatever.
Yeah, it's likely to be insured. Um, so it's what I find interesting is the crime stats, as weird as they are, and it is complicated in the U.S. We have seen an increase in murder since COVID, and that's actually kind of a worldwide phenomenon. But for us, we have so many more murders anyway that compared to Canada or Europe, that it does seem kind of intimidating and astronomical. I'm not going to deny that as a problem, but the crimes associated with homelessness have actually not gone up with an increase in homelessness, which is not to say that we should be glad there's an increase in homelessness. Um, like, that's not my point.
Yeah.
But I think that population gets blamed for a lot. I will say this though, I have not always loved how activists have handled this situation. Particularly, a lot of homeless advocates have often put inadvertently um, um, mentally unwell people in bad situations with the police without meaning to.
Right.
Um, and I don't know, that may not be as big of a problem in Canada, but it's definitely been in some of the major cities here in the US, where also activists don't really know how to interact with these populations either, and how to de escalate.
Yeah. Yeah. I mean, that's a problem. I mean, you have to be educated and like receive training on this kind of thing. You can't just be like, I'm gonna be a savior and like
Yeah,
walk
it's a
in
bad
there.
idea.
Yeah. and like also for people who might find a person who's homeless unpleasant, like that's fine. You don't have to like love them. It doesn't matter what you think of them. The point is that they deserve to have that dignity of, they deserve to have a shelter and to have food and to be able to kind of uh
Yeah.
not be out in the street where it's dangerous and cold. We're in Canada, right? So like it's when you mentioned substance abuse, actually, there's a lot of overlap between that and schizophrenia because a lot of people who have substance abuse disorder will also experience certain symptoms that are very similar, like delusions or paranoid behavior. So I think that substance abuse disorder also is very, very stigmatized, and there's a lot of overlap there between them and schizophrenia, and it's often a comorbidity because people who are isolated and stigmatized are much likelier to resort to using certain substances. And they also will often experience very similar symptoms. So this is a very much a very connected issue, I think.
Yeah.
Yeah.
Yeah, I think that's a fair assertion. One of the things we've had in America, I don't know, again, like the Canadian discourse is usually, I always find the Canadian discourse somewhat interesting. I used to be able to judge the Canadian discourse by splitting the difference between the US and the UK. The UK, however, has gone off the reservation, to use an also kind of problematic phrase.
Right.
In the last decade, that I can no longer use that as a gauge, because I'm like, well, yeah, sometimes in some ways the UK is actually more aggressive than the US in certain things now, so can't use them as the barometer for Canadian culture anymore.
Right.
Um, but I think there is a perception that is somewhat misleading, and I did live in Canada a little bit as a child, so I am familiar with it.
Oh, wait.
Um, yeah, I lived in Halifax for a very brief time. My father's a dual citizen.
Right.
Um, um, so, and I keep up with Canadian politics, and like I
Mhm.
remember things like when the progressive conservatives were a thing. Like, also because I'm old.
Oh God. Yeah.
Yeah, trying to explain that to Americans is real fun. Um, but the one of the things that I have noticed about about the American relationship to Canadian discourse, and is that because things are relatively more humane, and because social services, particularly education, is so much better in Canada that there's a tendency to not realize that there actually is not as huge of a difference between our societies, um, as is often painted by both sides.
Right.
And on this issue, I think what we see here is like a spectrum, and the Canada's not that. I mean, it's better than the U.S. It's not that much better, and the stigma
Yeah.
is actually universal, like nearly. Um,
Yeah, I mean, I don't get to have dental or vision. It's just, you know, just some.
yeah, 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 yeah. I could go off on a whole tangent about people not understanding how limited, and also that your province really matters
Yeah.
for the quality of the national healthcare services. It shouldn't be, well, it's not national, it's provincial actually in most cases.
Mhm.
Um, and it's not really an equivalent to the NHS, which also has its problems, but
Mm.
is a little bit easier to talk about coherently. Um, so yeah, yeah, no dental. um, I want to talk about relative healthcare treatment on this though. I mean, one of the things that I think we have finally seen a move away from, and this isn't so much a part of your article, but is the all or nothing view of, say, psychiatric pharmaceuticals for the treatment of
Mhm.
mental health disorders. And the United States was pretty much in the everything can be solved by a pill for a very long time, because it was convenient for our insurance framework. Whereas that seems to have finally fallen away here in the last 5 to 6 years. Um, where does Canada stand on that, and how does that play into this stigmatization of schizophrenia? Because one thing I know about antipsychotic drugs is that they help, but they do not solve the problem, whatever that is.
Right. Yeah. I mean, I think that Brian's Law is actually a pretty good demonstration of how I think in Canada it is very much assumed that the drugs will help you, because often the conditions that are included in the CTOs include, like, first and foremost, include taking certain medications. And, I think that medications are extremely helpful. They can do a lot of great stuff, but I mean, absolutely not the full picture, right? Like, it's not completely, not going to solve every problem, basically. It's not going to solve isolation problems, not going to solve stigmas, right? And there was actually a case that happened in Canada that went to the Supreme Court of Canada, the highest court. It was basically this physicist in Ottawa. His name was Scott Starson. He actually wanted to he has schizophrenia, and he was institutionalized because he made death threats in public. And obviously, that's a very uncomfortable thing to experience. Like, I understand, right? So maybe it doesn't warrant institutionalizing a guy, but that's a whole other issue. He actually sued. He sued the provincial government, and he kept taking this case further until he got to the Supreme Court. And the Supreme Court actually ruled in his favor in the end, that he didn't have to take medications if he didn't want to,
Mm.
because the central argument was, is he able to consent to treatment? And a lot of psychiatrists, I think two psychiatrists were testifying, and they both said he cannot make an independent decision because he's too impaired because of his condition. Therefore, the healthcare, like the institution, must make a decision for him, and therefore he has to take medications. And throughout the trial, it became pretty clear that he is actually quite capable of consenting to, or I guess refusing to, a certain treatment. And the issue was that he had been deemed incapable of consenting to, I'm sorry, incapable of decision making, because he had said no to medications. So there was this assumption by his doctors that because he had said no to the medications, he therefore probably doesn't have a very good understanding of the medication's effects, and therefore cannot make a decision about a treatment. So I think one problem
That's a
that
catch-22 if I've ever heard one. If you refuse the medication, you are definitionally unable to um to make a decision about the medication, because clearly if you refuse it, you can't know what it does.
yeah, that's essentially the problem. Yeah, with that like line of thinking. Also, like, what does that mean? Does that mean that if you said yes, but you couldn't actually consent, then they would never have no, like, they probably would not have deemed him incapable of consenting or making decisions if he had said yes to it, even though you can still be incapable if you say yes, right? Like,
Mm-hmm.
doesn't make any sense. So anyway, the Supreme Court ruled in his favor by saying that clearly he has the capacity to make a decision, and he doesn't have to do it anymore. And so this brings up a lot of interesting things about decision making capacity in general, I think, because there's a lot of myths surrounding that idea. There's the myth that if you are incapable of making a decision, you will remain forever incapable. That is not true. It's actually been proven that if you are educated on your condition and you understand your condition and accept that you have it, you are much likelier to be capable of making a decision for treatment, or I guess refusing treatment, right? Also the idea that if you say no to treatment, that you are therefore incapable. Again, this is the same paternalist idea that, like, this is for your own good, so do it, kind of thing, right? And yeah, I think it was pretty clear in his case that a lot of institutions in Canada, particularly the Canadian Psychiatric Association (CPA), basically believe that if you say no to a treatment, you are probably too impaired to decide. And we need to have better, guidelines for how we document or test a person's decision-making capacity. We should test their capacity to decide whether or not they say yes or no, like no matter what. Whatever their answer is, we should always try to evaluate their ability to make the decision. And we should not expect that healing is only physical, right? Healing is not only a physical process, or not always healing, but like recovery and management. That's what I meant to say. So recovery and management of a condition, be it schizophrenia or be it something else, is not just physical. It's not just a drug thing. Of course, drugs can help because they can mitigate certain, imbalances in the brain and neurochemical problems, right? But they don't necessarily help their mental health in general. They don't necessarily address other comorbidities like anxiety or depression. Um, and again, we need to have changes that have to happen in the social structure, because a lot of interpersonal stigma will affect the person's quality of life, right? Quality of life is not just how healthy you are, it's also about how integrated you are into society. So you being able to have friends, have a social group, be able to have hobbies, be able to have a job if you want to do that, right? And like be able to participate in parts of society that you want to is also very important for your well-being. So yeah, I definitely agree with that point. And I think that the case with Scott Starson was very, illuminating of how a lot of institutions think and approach healthcare in general. Yeah, it has to have a both, cognitive behavioral therapy angle often, and it also has to have a, I guess you can also offer a drug therapy route.
One thing that your article brought up that actually ties into this last point on cognitive behavior therapy,
Mhm.
um, uh, is something I have learned in teaching spectrum disordered patients, is that we assume that someone is irrational or cannot intuit social cues or whatever,
Yeah.
because it is ironically conscious for them, whereas for most of us it is, quote, most of us normies, it is an unconscious process in a lot of cases. And what your article actually indicates is the research on this, even with schizophrenics, is that if you model decision making behavior and explain to someone the likely limits they're going to have,
Mm-hmm.
they actually do end up making pretty insightful, rational choices. And there's evidence to back this up, but you have to explicitly go over things that are for the majority of the population they pick up implicitly. And if you've ever dealt with, you know, autistic spectrum kids and learning disabled kids, this should be natural, and yet we treat schizophrenia and other schizotypal disorders in such a special category that we don't imagine that those rules could apply to them. And I found your article very interesting because even in the psychiatric literature, I don't see that discussed very much when we talk about educating, which is, you know, what I deal with on this stuff. Um, Kids with schizotypal disorders, because, like I said, one of the things is because of the inability seemingly to educate them, and because they're seen as such a constant problem in a lot of countries, we remove them, or institutionalize them, or put them in isolated classroom environments with other high supports children, often who have intellectual disability to the extent that I would say probably pretty alienating to a lot of the schizophrenic students, because the ability to articulate is going to be different between the two groups. Unfortunately, yes, we still use IQ scores to talk about a lot of this, and I'm really trying to avoid that. So, it is interesting. I also like that when we look at, we talked about how you talk about how schizophrenics often do show up as a standard deviation lower about on a lot of these intellectual capacity inventories like IQ, but that in other social and emotional categories, they actually show up as somewhat above normal, particularly if you point out that they often are aware of things that other people don't notice. So I find this element of your article very interesting. Now, you know, this is a show that's very interested in socialist politics. Strange Matters is, I guess, a libertarian socialist, whatever that means, magazine. I know what it means, but it's, what should we be doing as a political matter on these issues? And we talk about what we need to do socially, but obviously a lot of the social stigma is tied up in political choices. What kind of political choices do we need to make to undo some of this stuff?
I mean, I think that the biggest thing that we really need is more social support. I know that you mentioned like more political than social, but I mean like the social programs that are really valuable to people are really, really important. So for example, I think, for example, during COVID, when we were all at home and we all kind of like had less work and all of that, our government actually gave out $2,000 per month to everyone. Okay. That like saves me because I had to pay
Oh,
rent.
so nice. Anyway, go ahead.
Yeah, but that's so important, like, just being able to have support from your government because, the money is coming towards you to help you survive a certain difficult period in your life, right? Maybe, like, often people who have schizophrenia may have a relapse, where their symptoms might return or they have to get readmitted to the hospital. This is a very crucial period, for example, in their life, and this is important, it's important to have social programs that can provide support during that time, for example. I think you also could have programs that can support their caregivers. Many people have caregivers who may take care of them or may have a plan set, ahead of time for things like what to do if a person has a very serious or, erratic episode, for example. And so that kind of support, I think, is really important as well. I'm generally kind of a more leftist person, so I always want more support for people. I want less of a crime and law and order perspective. And I think that these kinds of legislations are really, really harmful and should be shelved, if anything. I think that, uh, it's much more important to have a very, pro autonomy sort of outlook. And when you mentioned the thing about how you can actually teach someone to better understand their options, their outcomes, right? There's actually not as much talk about this in the literature, but I have seen idea of implementing differences in healthcare, such as having things like motivational interviewing, which is basically this idea of clinician and a patient having more of an alliance relationship, a very close and positive relationship, which includes a more kind of informal conversation where you actually will have just like more focus on building rapport, and you have to kind of the clinician will have to establish things like understanding whether or not a person has capacity to make a decision, basically going through all the stages of understanding and communicating and advocating for that person's like rights, or self what's the word basically like their self-interests, and that kind of policy I think is much more important, because in that sense you give the person a much more I think secure and healthy relationship with their actual institutions. When I mentioned earlier that there's a disparity in racial populations, and you're likely to have a person of color being diagnosed as a schizophrenic person, this is a problem, not only because of institutional bias, but also because people who are people of color tend to be much more distrustful of the healthcare of healthcare in general, because they don't really trust doctors. They don't like a very paternalist attitude from doctors. I mean, my family is pretty ethnic, and I've seen that happen a lot. You know, you don't want to be told what to do by a doctor, and so I think initiatives to help combat or have more of a dialogue and sort of address things like institutional racism also is very important. And that also, it kind of like that overlaps with things like decriminalizing substances such as certain drugs, right? Which would help take care of the homeless population, obviously, and providing housing, and supporting the people who are most vulnerable, essentially. That's kind of what I think is most important.
Yeah. One thing I think that I like about implicitly in your article, and maybe I want to draw this out and talk to you about it, is you're not pushing against the medicalization model, but you are very much making it clear that the medicalization model, if it is paternalistic and not socially integrative, is still going to be a problem. Like, just declaring something a disease as opposed to a moral failing doesn't really clear up a stigmatization. And in fact, in some ways, it implies that there's nothing that can be done. You're a lost cause. And that's worrying. And to put it minimally. Yeah. And I also think we have to sort of disentangle a binary of, we either have things as a medical cause or as a social responsibility. Whereas, like, well, honestly, I think a lot of schizophrenic people would like to have some more social responsibility than they're even given, because that would imply that we view them as agents and that they're integrated into society, but also that we realize there are limitations, and there are some things they're not going to be able to do as easily or at all. I like that. I don't know. I don't think you stated that explicitly, but that's what I pulled from it, because I have been, I am a skeptic of over medicalizing a bunch of things, including things like addiction. But I'm also a person who really hates that if I say, well, we shouldn't totally treat it just as a disease, everyone just goes like, well, you're totally morally culpable then. And I'm like, what? No, that's not what I'm implying at all. Like, another thing I thought about as I was reading your article, is that in general, we should probably think of, how I frame this as, you talked about the social, and now we need to talk about political. But one of my major contentions, is that the social is largely in, maybe not downstream, but is in dialogue with political conditions. Um, so we can't change. For example, I don't know how many people work in public institutions in my audience, but if you've ever worked in schools and in the United States, this is a nightmare because as federalized as Canada is, the U.S. is like basically 50 governments that don't get along.
Right.
Um, uh, the definition for most conditions, whether they are psychiatric or learning disabilities or whatever, are actually defined not even by the DSM, the Diagnostic Statistical Manual of the APA, but by legal fiat in a lot of states. So, for example, what conditions account for the federal 504? That's defined, and this is not going to mean anything to your Canadian listeners, but it's basically the right for medical as opposed to learning disability accommodations in the classroom and stuff like that are decided on by definitions decided upon by state medical boards that are politically appointed.
Oh, okay.
Yeah, in most states. In some states, they're not. And again, it's hard to generalize about the United States. See what I said about 50 governments that don't get along. But Canada is more federated, I think, than Americans realize. So when I explain this to Canadians, they tend to get it. The British, unfortunately, have a harder time with it. They're like, "What?" I'm like, "Yeah, we don't like our national government is basically an insurance program that kills people. Like that's like." Um, it's a military with an insurance program built on top of it, but that's about it.
Wow.
Uh so that really complicates things because we're not just dealing with stigma, we're often dealing with like very desperate legal definitions that are not consistent even from state to state. One thing I think we really have to pull for is I don't just think this needs to be consistent from state to state. I think it needs to be consistent fairly from country to country. So we really should be advocating for international cooperation and common sets of definition on this, at least socially, and then we can start looking at policies that would work both within a governmental framework and within an extra governmental framework. Because I also think you can't get the government to do all of this. So some of this stuff takes a much broader, view of society to fix. And I also think, and this is not so much to you, but for the political radicals, I think one of the reasons why Strange Matters published your piece, and I actually haven't sat down with the editors and asked why, but I am deducing here so they can correct me. Is that really thinking about this in a different way is going to be really important for socialists to do. And a lot of times, socialists actually do more than they realize, accept the general definitions of stigmas in their society on what is valid and invalid more than they even are aware of. And I think I think about the Soviet Union and homosexuality, but I can go on. Like there's been all kinds of times where we don't have a set of biases that different from the general public, even though we think we're cooler than them. So I think that sort of humility is actually going to be important when we're talking about the kinds of mutual aid or social programs or whatever we need to do to integrate people with quote unquote severe support needs into our society. And I want people to listen to the way we talk about this, like when you talked about healing and reframed it as recovery and integration, and you'll hear me, instead of talking about high and low functioning, talk about high and low supports, because I think that is a better way to frame it. I don't want to pretend that like all spectrum students or all schizophrenics have the same support needs. They don't actually. That's
Right.
another thing. Like this, like what's I mentioned that I've had someone with schizotype seizures in my family, and I've known schizophrenics from family friends, and the spectrum of what that was, like one person that I knew you would never know unless you lived with them, and another person you would immediately know, like, and neither person was going to be dangerous to you. Neither person was, they both actually both had families and whatnot. They weren't socially isolated, but that's a big gap. And if we talk about it in a blanket way, we can't deal with the fact that there's a huge, with most of these conditions, there's a huge spectrum of people's support needs and how, and the way it manifests. And one of the things with schizophrenia is it's not even defined that clearly.
Yeah.
So, um,
Yeah, absolutely. Yeah. I mean, I think that, I'm not going to deny that there are some people who have schizophrenia, a very small minority, of course, that may act violently. And I'm not going to deny that. But I also will point out that a lot of that violence comes from possibly abuse or trauma earlier in their life, and there are certain conditions in society that cause that to happen, and maybe we should address that rather than wait until the crime is committed and then put them in jail or whatever, or put them into a facility or something like that, right? So it's obviously not a homogeneous group, but there are also reasons for certain things that manifest out of that. Absolutely.
yeah, trauma plus anything increases the likelihood of violence. And I also say this, I'm gonna put asterisk on this. Trauma, however, even though I said that, I'll be public about this. I have a diagnosis of PTSD. Um, um, does not in and of itself at all mean that someone's going to be violent. But
Yeah,
of the
exactly. Yeah.
but of the things that we stigmatize, it's the one that actually does have legitimate links, and it's still rare.
Yeah.
Like, most people with PTSD are not going to be dangerous to anyone. But it does have significant statistical correlations.
Mhm.
With schizophrenia, that's not even there.
Yeah,
Like,
that's
the,
really, really small. It's negligible, I think. It's very small.
and I'm guessing if we really had good studies, we'd see that what we do see there is probably tied to trauma and in poverty and a bunch of adverse conditions, which would, even with quote the mentally normal or the neurologically non-divergent or whatever we want to phrase that, would also be correlative with more violence. I mean, like,
Yeah.
and in most of the cases, the violence threat is to the self, actually, in almost all these cases.
I was just gonna say, yeah, like it's actually more likely to be on the self than others, because I think the suicide rate for schizophrenic people is even higher than the rate of violence against others. So it's
Mm-mm.
extremely troubling, to say the least. Yeah.
Yeah, yeah, and that worries me. In my country, we've seen a net increase in suicide in general.
Mhm.
So I'm sure we probably see it um, in relations to uh, schizophrenic populations. I haven't looked, but
Mhm.
it would be a totally rational um, inference to make. Another thing that I would worry about is in my country, like I said, the thing that ties you with the most likely, even more than race, although that's comorbid, um, here, is that if you are mentally disabled and you have an interaction with police, I think it's your chance of that being lethal is like up 50% from the general population or something. It's
God,
obscene.
that's
Like,
ridiculous. Wow.
so
Yeah.
um
I mean, I think that lots of people in Canada also will trust the police, even though the police are not necessarily, they don't have a great record either here. I mean, I think the Canadian Psychiatric Association still says on their website that you should call someone, like call the police if the person who's schizophrenic is having a suicidal ideation. And I don't know if I agree with that per se, but it is still a guideline. Like it just is.
are they trained to deal with that in Canada, because they're not really in the US?
Um, I don't know a lot about the exact specifics on the training, but I know that it's been becoming more and more popular lately to train the police to, like, if they're called, to simply not do anything, to just simply be present and but be passive. Um, but that's come with like a lot of protests and a lot of demands for change and reform, and it's a very recent thing. So it's kind of only in its baby stages right now, to be honest with you. So.
Yeah, well, here in the US, we actually Um, I'm just going to note my natural inclination to use schizophrenia as a metaphor just almost came up, which talks a lot about the stigmatization. I'm just going to point that out for everybody. It is more incoherent than that. So we have some policies encourage non-action, but then when something happens and someone actually does kill themselves, unfortunately, there's a lot of pushback to that, naturally and rightfully. But then when you think about, well, but what the cops generally do is you just move who's likely to do the killing in our country. So the there doesn't seem to be good options except for we need to find another way to handle this other than the police. So that's in general the thing that I would point out to people here, that I know why, and I feel it's natural when police do nothing and something happens, why people would respond negatively to that. But then if they think about what they're encouraging, it's like, well, do you really want them to get involved though? Like, what are they likely to do? Like, and I have some horror stories from the Southeast that I could tell about that, but I'll spare you. Thank you for coming on. I want people to read your article. I got a lot out of it. And I was at first, when I was talking to John Michael Colon on this, I was like, well, people are not, it's not going to be obvious why a show like mine is going to talk about this, but I think as we talk about it, it'll become clearer. Just like it was, I was like, oh, stigmatization of schizophrenia in a socialist journal. Why is that there? But it's important that we actually include this and think about this and how we handle integrating with people. One thing I'm gonna say about marginalized political movements is we also tend to be comorbid with a lot of mental issues, because we're people who are dissatisfied with society tend to find radical politics in either direction, right or left, somewhat mollifying, because it seems like we're speaking to a fundamental dysfunction which is leaving them out. And so we really do need to have mature, non-punitive, non-paternalistic, inclusive, but also medically informed and scientifically informed
Absolutely.
stances on this. Otherwise, we will also be irresponsible.
Right. And I think also, like, no matter how confident you are in your ability to, I don't know, like in your beliefs, in how, how leftist you think you are, I think you're still prone to having certain biases that you don't know about, that you don't realize you have. And you also are surrounded by other people every day. You're hearing these messages and these implicit biases all the time. So you have to always consistently question yourself and be aware of how you could be thinking about it, or change your way of thinking about it. So definitely got to always think about that.
Yeah, I think that's important for us to do, particularly when we are also trying to craft healthcare policy or advocate for healthcare policy in the political spectrum, for us to, because I think a lot of people would actually would not think about the stigma around schizophrenia very much. They might talk about it in the general stigma around mental health, and even I did. I think I probably did that in the framing of this article. I was like, mental health, because schizophrenia scares people. And now I'm like, I'm probably going to go back and change the title, because now I'm like, that was a bad move. Although I think it is interesting, because it is sort of I think schizophrenia is one of the case examples of things that are still highly stigmatized, despite our move away from prior associations. I mean, bipolar disorder and stuff is still stigmatized too, but there's an increasing call for normalization. There's a call for normalization for schizophrenia, but no one listens to it.
Yeah.
Like I was like looking at your videos included in the online version of the article, and I was like, oh wow, I should probably notice that people are calling for this, and yet I have not ever seen one of these videos shared in our circle ever. So
yeah.
Thank you so much for coming on. Do you have anything you'd like to Any other articles or anything you'd like people to read to suggest as we are heading out?
It's my first time writing with Strange Matter, so I can't exactly direct them to other articles. I do occasionally write for a site called inkspire.org. I write some science articles there. I have some stuff on like long COVID that I was really interested in talking about. And I don't really use social media that much. I don't like go on Twitter that much, but
It's
you know,
probably wise. It's bad for your writing career, but it's good for your mind. So
it just changes too rapidly for me to be able to keep up. I can't do it. Like it's too much.
fair. That's actually probably the correct response.
Yeah.
So yeah, the general call for plug was not just for Strange Matter. So I'm glad you mentioned your work. So what's that site again?
It's called inkspire.org. Yeah. I
Inspire.
just read,
Okay.
yeah, I have a couple of articles there. I don't often do a lot of writing, so this is kind of new for me. So, bear with me. There'll be more in the future. But yeah, please check it out.
Yeah, thank you, and thank you for showing that talking about this in a scientifically literate way does not mean uh, being a robot.
It has
Now,
more dimensions, yes.
yeah, I now have to do the thing I enjoy doing least in the world, which is selling something. But Strange Matters magazine is a co-op that's completely funded by you guys. Um, they have been successful off of their initial run, but they are sustained by subscription. So if you would like more completely independent, non-commercial stuff, unfortunately, in our society, the irony is you do have to pay for it, and we would love to make that not the case, but unfortunately you do. So if you are interested in these kinds of articles, please subscribe to their journal. They need it. They actually pay market rate to their writers, which in socialist journals
Yeah.
is really rare.
Yeah.
I think I quit write I personally quit writing articles for political publications because they never paid me ever
Wow.
ever. So
I
uh
think Strange Matters is the only place that I've written that has paid me. Like a lot of the site that I mentioned earlier, Inkspire, it's a voluntary thing. I don't get paid for that. Like it's not often that you find a place that pays you for your work, which is great. So
Right.
yeah.
So if you were supporting them, you were actually supporting writers and advocates and stuff like that. So I'm done selling. I'm bad at it. It's not my calling in life, but I thought it was important to bring it up. Thank you so much, Zhala, for coming on tonight, and I will be following your work in the future. Have a great evening.
Yeah, thank you so much for having me. I appreciate it. Have a great night.
You too.
Bye.
Bye bye.